I think any of us thought it would take to like get it back to a semblance of normal. And, as we're seeing now, a third wave is going through Europe.
Yeah.
We're hoping that doesn't happen here. We're seeing good results with vaccines. We're seeing good results with, people taking care of themselves a little bit better, making sure they're washing their hands and doing what they're supposed to do. So we're hoping that third wave doesn't come around here.
Nice. Jason, just getting a little bit more about you, how you came here. Like, it was your goal to be in IT and becoming CIO?
I mean, not originally. I always liked computers. I got my first computer, I think I was 6.
Oh,
It was
wow.
an old IBM PC Junior,
Nice.
with, I think it was 4K of RAM. So, and you could do a lot with 4K back then, which you can't do anything with it now. And I started programming when I was a kid, doing basic.
Mhm.
Took a couple classes in school. We did, I think it was called Logo on the Apple, where you made the little turtle move, which was a
Okay.
lot of fun. And, got into the programming part of it. And then as I was going through school, I was always, I like technology. And so when I was looking at what I want to go to school for, I wasn't really sure, but I figured, I'm going to go into something with computers. I know that it's going to be a good field.
Yeah.
And it turned out pretty well for me. So I got my undergrad in computer science.
Mhm.
So I was a developer, and my first job after college was a software. I was working as a software developer for a government contractor. And I
Right.
think I probably wrote more code my first 3 weeks of work than I ever did in my 4.5 years of school.
Yeah, that
I
helps.
learned really quickly the difference between the two. And then knowing kind of where I wanted to go, that's when I went and got my master's in business rather than
Oh,
doing it in computer science. I thought it would open up more doors for me and give me a better rounded experience.
no, previously I was watching one of your, interview with CIO forum, right? That was one thing that, like motivated me to talk more about you, how the technology is solving this vaccination that is going on because you have a lot of people who are coming to you and you have to serve them.
Definitely. We would not be able to do it without technology. We've seen that. When I first started here at the health district was back in 2009, and we were going through H1N1 back then, if you remember back to that
Mhm.
pandemic. And we did all of the vaccinations, and it was all paper based. So everything was done. People would show up, they'd wait in line, they'd fill out a paper, they'd get their vaccine, we'd write it all down on paper, and then we'd take that paper back to our office, and then we had to digitize it later on. And we brought in a ton of temp staff, and we had probably 45, 50 people working on it for about 2 months straight, just digitizing the records and just really scanning them and indexing them into our document management system so we'd have them for the future. And we saw what kind of undertaking that was, how much it cost in the long run, both in terms of time and money. And we saw that it just wasn't very responsive. And so, I was still new here at the time, but it gave me an idea of how can we do this better. I was watching how we do in our points of dispensing. Everything was paper-based at the time. So I started working with our disaster preparedness team to say, we can do this better. We can do it with technology. We can simplify it, not just for the back end part of it, but really also for our patients. So they don't have to fill out any forms. They don't have to worry about, dealing with the paper. Plus, when I was watching some of these pods happening, they were just taking the paper and tossing them into a box on the floor, and some of them were falling out of the box, and I seen paper getting kicked around. And so I was thinking, great, there's records getting lost, and there's also potential HIPAA violations going on,
Mm.
with some privacy issues. So I'm like, okay, we got to do something better. And then that's where we started looking at what are our options.
Now, what kind of technology you are using today to solve these issues?
So the system that we're using right now for the vaccinations, it's built by MTX, a company out of, I believe, Dallas, and they work with a lot of different technologies, and they use Salesforce as the back end. So they're able to quickly build on the Salesforce platform, and they called it the Safevax. And so that's been used in a number of other cities and states. And what it allows us to manage all of our events and say, when we have slots open, how many slots we have, whether they're for first dose or second dose for either, and then put those online. Then the patients can go online, put in what their tier level is or their eligibility level, and then it shows them all the eligible sites that they can go to. So
Oh,
then they pick a site, they fill out their contact information, get the information that we need, and then they register for their appointment. When the day of their appointment comes, they get an email to tell them to go in and do the screening questions, where we ask them, are you sick that day? have you ever had an adverse reaction to a vaccine? Have you had the COVID vaccine before? All those different questions that we have to ask. They answer those, then they go down to the vaccination site with their code that they got, and either with the QR code or just type in their appointment number. We get them in, we check them in, we verify all their information, we send them to the vaccinator, and they get their vaccine. If it's the first dose and they're getting either Pfizer or Moderna, where we need to do a second dose, then they're able to schedule right then for their second dose, either 21 or 28 days out. They schedule that and they come back again in those timeframes, and then they're done. If they're getting the Janssen vaccine or the Johnson & Johnson one, they get their one dose and then they're done. And then that data is now instantly transferred up to the state vaccination system. Whereas in the past, we do it on a nightly batch upload. Now it's a real-time system. So once the vaccine is done, it's sent to the state, then the state can compile those numbers and give those to the CDC. So we get a more accurate representation of the number of vaccines done in a more timely manner.
What challenges you think you faced when you were rolling this? Because I think so there will be some problem that you initially faced, right?
Yeah, there was always some issues. We were coming off of a homegrown system that we were using, and going from one that we wrote in house so we could customize it right away to a statewide one where we lost a little bit of control, and that made it a little bit more difficult for some of our people on the ground, because they were used to saying, hey, we have this issue, we have this idea, and then we go hack it in and we'd have it in either that day or within a day or two. Now it's like, okay, we need to go through this whole process. So it slows down some of the innovation, but it makes it a lot easier for us, because when we were doing our internal one, we only had 5 people working on it. Oh. And so it was a lot of work for 5 people. Now we have the backbone of Salesforce and MTX. So, we have thousands of people working in the back end to make sure that it runs. Plus, we have a statewide team making sure that we're doing all this correctly. So we're able to leverage each other's strengths and weaknesses and really divvy up that workload to make it easier. But we did have some, adoption processes because it was different than what we had done in the past. It was a new system, and we did our implementation in a 3-week time period. So, anything going that fast, it was a beta product when we launched it. We went live with the beta. I mean, and I think anyone in IT knows what that's like. We're finding little things here and there. We're finding little glitches, nothing major. That was the nice part about it. We found most of those through the testing and configuration, but there are always little things. And then came down to reporting. As anyone knows too, reporting is one of the last things you do in a system. So it came down to, okay, what are the reports that we need? So we were trying to put those together on the fly to try to give the people on the ground the reports that they needed. And we're still continuing that to this day. So when we went live, one of the other issues that we had was not wanting to lower the amount of vaccinations we were doing too much, because we had a supply and demand issue, where if we said, okay, we're only going to do 1/3 of what we normally do, it would really back us up on other days. So we tried to go down to half, and the first launch was okay because we're on a smaller site. But then when we went live at our major sites, at the Las Vegas Convention Center was one of our big sites, and anyone who's gone to CES knows what the convention center is like. We were doing 5,000 to 6,000 vaccines a day there. And to cut that down to, 2,500 or so, just to make sure that we could get it done with the new system, with the training going on, and knowing that, it's going to take a little while for everyone to get up to speed, it was difficult. So we did that for 2 days, and then we got up after about 2 days, we were back up to full speed. And by the end of the first week over there, we were back up to over 5,000 vaccines a day at that one site.
Listen, that just to see, so if somebody like you in other, health district is doing it, what you would suggest to them to do something initially faster than the other steps, so they can make this transition easy?
Oh yeah, what tips did I give them? I mean, fortunately, anyone else that's going live with this type of system, they're gaining on the benefit of all that we've already put into it, because a lot of the stuff that we put into it has changed. But I would say definitely keep it simple at first. Don't try to jump in and think that we're going to be able to do the same numbers that we were doing originally right away. Manage those expectations, over communicate to your teams, and to even to the public, over communicate a little bit more than what we're doing, because they need to understand why it's slowing down for the first day, because we know it's going to make it better in the long run. And then focus on the training aspects. The more you can train, the earlier you can start training on it, I think the better off you are. I know it's tough when you're in an emergency and we're all busy, we're all doing things, but taking that time to sit down and do that training